Speaker. Sierra Leone has so far received 2 consignments of COVID vaccine doses of China Sinopharm COVID-19 vaccine donated by the Chinese government, and the AstraZeneca Oxford COVID-19 vaccine shipped via the COVAX facility to support the country's vaccination campaign. It is expected that these life-saving vaccines, which are now available for COVID-19, combined with other important measures adopted by government since the pandemic started, will afford the country a good prospect to return to normalcy and to fulfill the country's obligations under the Universal Health Coverage Program. To throw more light on the rollout of the distribution of the vaccines, we have Mr. Solomon Jamil, who is the spokesperson for NACOVAC, accompanied by experts from the Ministry of Health and Sanitation. Welcome, sir.
Thank you, distinguished Director Toure. My respects to Honorable Minister Mohamed Rahman Soare and the entire team at the Ministry of Information and Communications, and it's good to see colleagues. I see my State House distinguished friend. So Fonty and all my friends in the House, thank you. Elba, I see Joe is hiding behind. So today marks exactly 1 year since the World Health Organization declared SARS coronavirus 2 as a disease of global concern. And the world has recorded over 118 million cases and over 2,600,000 deaths, including 79 deaths recorded in Sierra Leone. So on that note, and with the leave of the Honorable Minister, who is the chair of this session, I ask that we all kindly bow our heads in tribute to all the lives that we have lost. And also as we continue to pray for our health workers, our frontline workers, as they continue to help to protect us. May their souls rest in peace, and may God continue to keep our health workers and direct them accordingly. So until late last year, we are all fully aware, as the globe continued to record cases, as we continue to see hospitalizations increasing, as we continue to see case fatalities rising, the key question was, when will the world have a vaccine? Today, it's a question of access. Today, it's a question of equitable distribution of the vaccines. And that is why for us in this part of the world, we feel tremendously comforted that we have initiatives like COVAX, the COVID-19 Vaccine Alliance. And as a matter of fact, the government of Sierra Leone is partnering with the World Health Organization, UNICEF, the Coalition for Epidemic Prevention, Epidemic Preparedness Innovations, CEPI, Gavi, etc. So government of Sierra Leone continues to enjoy that partnership with them, and it is through that COVAX facility, as Mr. Toure has said, that we have been able to land 96,000 doses of the AstraZeneca Oxford out of an initial 526,000, possibly in the first phase of the rollout from COVAX to Sierra Leone, as Sierra Leone happens to be the 9th country in Africa that is receiving such a donation. So complementing that, we are all fully aware that some time back we received, courtesy of the People's Republic of China, 200,000 doses of the Sinopharm vaccine and over 201,000 pieces of disposable syringes and needles. It is on the basis of this limited vaccine supply that NACOVAC, the Ministry of Health and Sanitation, and our partners, we have done a priority distribution plan. We know that in the light of the limited supply, we definitely cannot vaccinate everybody. We have to prioritize categories of our population, looking at vulnerability, looking at those who are on the front line, looking at old persons, looking at persons with comorbid conditions. So those are the considerations that we have as and when we augment what we have as an existing supply, whether through our bilateral relationships or through the COVAX facility. We will ramp up vaccination and make sure we expose the facility to as many Sierra Leoneans as possible. And so I'm pleased to report that we have a COVID-19 vaccination rollout strategy in place. We cannot enter into such a delicate enterprise without having a rollout strategy. So we have a vaccine rollout strategy, and we have some important principles underpinning that strategy. So one of which happens to be safety and efficacy. And as we all know, both vaccines, Sinopharm and the AstraZeneca Oxford vaccination, they have gone through relevant clinical trials, validated not just at point of origin, but also in other countries in the world where they have been rolled out. When Sinopharm was rolled out to Indonesia, for example, President Joko Widodo was the first to be vaccinated. When it got to Equatorial Guinea, President Obiang was vaccinated. We see AstraZeneca rolled out in Ghana, and we saw President Nana Akufo-Addo. We've seen vaccinations all over the world. So with respect to the two vaccines that we have, Sinopharm from the People's Republic of China and the AstraZeneca Oxford from Britain and its partners, we are pleased to report that our experts have made a determination that they are suitable to be rolled out. It is on that basis that we will proceed to do the rollout on Monday, 15th of March. First, we will do the launch and the vaccination, high-profile vaccination at State House, and then we will do a follow-up on the 15th at the foregrounds of the Miata Conference Center. The rollout, as I have said, is perfectly anchored on our prioritization. Those who are prioritized will be vaccinated. So we're talking about healthcare workers, we are talking about frontline workers, we are talking about the aged, and we are looking at 70 years and above, and will continue to come down as we augment the existing supply of vaccines. We are looking at persons that have comorbid conditions. Within this framework, we would also have persons in the political class to be vaccinated. And as I have said, Monday, starting at State House, we will have so much visibility around that, and I'm sure things will become clearer from the 15th moving forward. I have just seen my friend and colleague, Harold Thomas, the miscommunication lead, who has just entered the room. So later on, as we interact with the issues through Q&A, myself and Harold Thomas will be pleased to respond to questions or take comments around this. So we have identified about 50 sites nationwide. For the districts, we'll be having 2 static sites per district and a mobile site. So 3 per district. And then in the western area, we'll have about 8 sites. Originally, the thinking was everything to fit into the 50, both static and mobile, but there has been an emerging thinking that we might need more mobile sites to complement what we have. So as and when those figures will change, the public would be informed accordingly. Vaccination is good. We have a fairly long history of vaccination in the world. And I think now we have vaccines to protect us from over 20 diseases. And having a COVID-19 vaccine is not the first vaccination effort in the world. looking at the cases that we have recorded, and as I said earlier, over 118 million cases globally, over 2.6 million deaths globally. Hospitalizations were increasing, and it was important that we have vaccination as an important step to help us protect ourselves and those around us. So it is a good moment to celebrate. And this is where, as a government, as the media continues to work with us to generate and sustain public trust, this is a key moment to watch. We have always counted on the media to mobilize, to put out the right information, to diffuse the myths, the suspicions, and the tensions. And we believe this is also a delicate period where we continue to count on the media to make sure that the right message goes out, to make sure that people understand the dynamics around vaccination, and that vaccination is important for all of us, to protect us and to protect our communities. And to also understand that there may be some people who perhaps because of some underlying conditions, for example, somebody who might be doing chemotherapy, if that person is advised not to take vaccination, if we take vaccination based on the priority and later on when the vaccination would ramp up, persons like that will be protected because those around him or her are vaccinated. So let people understand that vaccination is a good thing, it protects us and it protects our communities. And as I said, we have sufficient data that speaks to safety, that speaks to efficacy, and it is important. We don't want to get to a point where Sierra Leone would be considered as a red zone. Whilst the rest of the world is moving on and people are getting vaccinated, Sierra Leone is not. We don't want to get to the point where Sierra Leone would be listed as a country with high risk. So it's an important moment for all of us to celebrate this, that we have vaccines, a total of 296 vaccines, less what the Chinese embassy would have requested. And we believe that it is an important step to protect ourselves and protect our loved ones. So this is the brief that I have for us, and I'm sure we'll interact with the issues in due course. Thank you.
And lastly, this afternoon, the Student Loan Scheme is an initiative proposed by His Excellency President Julius Maada Bio in 2018 to support higher and technical education. Just last week, the Minister of Technical and Higher Education, Professor Alpha T. Buri, confirmed that the scheme will be piloted this year. Mr. Paul Amara is the National Coordinator for Student Loan Scheme Committee, charged with the responsibility of establishing the Students Loan Scheme. And he is here with us to update members of the Fourth Estate on the steps taken thus far to actualize the President's vision.
Thank you very much, Honorable Minister, Mr. Mohamed Rahman Slurry, members of the press, colleagues, fellow Sierra Leoneans. I come here on the heels of the public notice that was issued last week regarding the adverts for the Sierra Leone grants in aid. For those of you who are present, you will note that there was a caveat in that public notice requesting that all postgraduate, masters, and PhD applicants must begin to look at the student's loan to access funds for the pursuit of their degrees. My name again is Paul J. Amara, and I am the National Coordinator for the Students' Loans Committee that was jointly put together by the Ministries of Education and Finance in last year, July, to actualize the vision of the President, retired Brigadier Dr. Julius Maada Bio, to ensure that we have quality education in this country. I need not rehash the fact that Sierra Leone was once referred to as the Athens of West Africa. That title was not lobbied for. We did not ascribe that to ourselves. We are known by that because of the quality of education that this country produced. I'm very impressed that I am in the same room as the facilitator of this meeting, who is the minister, because at some point in time we are all together in our O levels, our A levels, up to college level, striving to see our own personal developments and the developments of others. Our stories are not unique in terms of the grace and possibilities that led us to higher education. A lot of students are being denied that opportunity because of lack of access to funding for higher and tertiary education. We intend to pilot as a first phase the Students' Loan Scheme with 500 postgraduate masters and PhD graduates or candidates for the 2020-2021 academic year. The Students' Loan Scheme is a new initiative. We want to make sure we think through it properly so that the formation is informed by actuaries and projections, by surveys that comes from the people, the voices of the people, their concerns, which we have done. You and I will agree that the recent activities of violence, strike action in public universities, is or are not a badge of honor that this country should be carrying. We shouldn't be proud of every year students or leaders of institutions are on strike actions because we can provide the necessary environment for them to study. Amongst other things, this is what has precipitated the immediate rollout of this scheme. It is evident that students have demonstrated the willingness to pursue higher education. It is evident that Sierra Leoneans are ready, Sierra Leonean students are prepared and ready to pursue higher education at any cost. What we need to do as a government, which has been demonstrated by the president, is to provide the necessary support. The Students' Loan Scheme, among other things, is one way to provide funding to access higher education. We witnessed where students were removed from examination halls at Frobe College because they do not have the money to pay fees. I can guarantee you that many around this room, or in this room, around this nation, are burdened with the need to help one or two individuals who do not have the means to pay fees. They have the willingness, they have the desire, but they don't have the means. And so the Students' Loan Scheme is here to help. All around the world, there is no country that provides free, quality, tertiary education. They can provide free, quality, basic, as we are doing now. But at the tertiary and higher level, because you want to pursue qualitative education, you need funds. And that is what the student loan scheme does. We are not oblivious of the fact that the rollout that will target postgraduate, masters, and PhD might create some tendency of mistrust or disappointment to the larger population of undergraduate students that are waiting for this. We are not oblivious of that. But as a program, we want to make sure that we do it the right way. We want to start well. And so the rollout is done with full commitment. I repeat. And I'm heavily depending on the press and the media for this, so that we don't kowtow to pressure, misinformation, that we made any promises of rolling the student's loan to every student, and now we are talking about a pilot to 500 or so postgraduates. I'm heavily depending on the media to understand that as a program, as a new program, it needs to be tested. But with a full commitment that the entire student population in the country pursuing or intending to pursue higher education will eventually be co-opted into the mainstream implementation. Eventually that will be done. That is the goal. But as I said earlier, this pilot gives every Sierra Leonean, not just the scheme, but every Sierra Leonean an opportunity to fully assess the impact of the scheme and to properly evaluate the activities. And as my colleague said from NACOVA, to ensure that public trust is gained. That is key and paramount to the success of any program. And so we request patience and cooperation from all and sundry as we pilot the scheme. Key pointers I will make here. Our office is going to be at the Brookfields campus, where the Meriti Magai Culinary Arts program is being run on Jomo Kenyatta Road. That is where our office is going to be. The application form has been completed for students' loan. It has been tabled before the minister and it is going to be approved, I believe. It is being reviewed and I believe that it's going to be approved pretty soon. Once that is done, we are going to make sure that a portal via the Ministry of Technical and Education is created for the Students' Loan Scheme so that students can access the portal and download the forms. We are going to make sure we use all the regional offices to ensure that the forms are also available. We are going to make sure that between March and April, deadlines will be set for submission of applications and also all other procedures that follows that will be made sure. We'll make sure that we'll make that available to the population and everybody. So again, I want to thank the Ministries of Finance and the Ministry of Technical and Education for helping the committee to get to this point. And I can assure you that we are going to do our level best to ensure that students' loan scheme becomes a reality in this country, and there should not be any need why any student should not pursue higher education because you don't have money. Thank you very much.